Good afternoon to one and all present here. I, Diksha Gambhir from Medisage E-Learning Private Limited, a platform where medical minds unite to elevate knowledge, share wisdom, and embrace digitalization to promote patient management globally, welcomes you to a Med Talk on HPV vaccination with Dr. Ritu Santwani. So it gives me immense pleasure to introduce our expert, Dr. Ritu, with us, a renowned obstetrician and gynecologist, infertility specialist, and sexologist. She holds prestigious qualifications MBBS, MD, FICOG, FIAOG Art Singapore, and is the founder and CEO of 360 Degree Healthcare Studio, NUHS Singapore. Recognized among the top 50 influential doctors on social media, she is also the co founder of MAAM and a board member of SWWC. So, Dr. Santwani, we would love to hear your insights on this important topic today. Dr. Ritu, over
Yeah,
to you.
yeah. Thank you, Diksha. Thank you for your kind words. And warm welcome to my all of dear friends who have joined all across the geography. Friends, I know this is a weekday and a busy afternoon. So once Diksha approached me for this session, so I thought, yes, we can connect on this and can discuss on this because these days we are getting a lot of youngsters are also coming to us with the queries of the HPV vaccination. And lot of doctors are also dropping me a message that they are having lot of queries. Yes, the company persons are coming and meeting them, telling them about the HPV vaccination, but still there are a lot of queries. So today we are going to discuss about that queries in the question answer from what usually the patient asks us and what is the query amongst the young doctors also, that whether can we give this vaccine during pregnancy or not, can give at the time of the breastfeeding or not, and more important, the doctors who are practicing like me the infertility practice, so can we give this vaccine once the lady is approaching to us for the infertility treatment. And some other queries is that like this vaccine we can give only to the girls, or males can, or boys can also take this vaccine. Is it like that this vaccine is giving the safety only from the cervical cancer or from the other cancers also? What are the wards? As I think all of you agree with me, those who are practicing the obs and gynae, there are a lot of patients of related to genital warts we are getting these days. I am seeing a huge rise in the patients of the genital warts these days. Besides this, because there is a lot of half knowledge these patients are getting from the any of the platforms, so they started taking the treatment by that only. And sometimes once we are seeing the patients of this warts or the some other infection, once we advise them for the vaccination also, they usually take the one shot or two shot along with the medicines. If the lesions subside, they feel happy, ma'am, the lesions has gone, why to take these all three vaccines? So what are the guidelines suggest? Is the all the three vaccines are important, or they, or only the one vaccine is sufficient? Is it the vaccine guideline is different for the males and females or what? So we are going to discuss these kind of questions. Credit goes to this girl Diksha. Diksha sent me a couple of questions what the routinely the doctors, the young doctors asked her to take on this Medisage platform, because this platform connects lot of young residents also, and there are a lot of queries. So friends, please take the advantage of these platforms. Those are giving you lot of knowledge. When I passed out 24 years back, हमारे टाइम पर ऐसा कुछ नहीं था. हमने कितने पापड़ बेले, lot of struggle we have done. Whole day we are standing in our seniors chambers, और sometimes in some different conferences. तो अभी तो आपको आजकल इतनी फ्री की नॉलेज इतना वाइडली अवेलेबल है, तो प्लीज टेक द एडवांटेज and start sharing of that, because knowledge always increases by sharing. More you share, more you get. And start doing the discussions. खाली पढ़ने से कुछ नहीं याद रहता, आप जितना डिस्कस करोगे एंड ट्राई टू पार्टिसिपेट एक्टिवली इन द डिस्कशंस. आपको एक बार में समझ में नहीं आता, बार बार पूछिए. जितना आप डिस्कशंस में पार्टिसिपेट करेंगे, दैट विल बी बेनिफिशियल फॉर ऑल ऑफ यू. So now coming to the topic, I am starting sharing my presentation. The what the questions we had received from the doctors, we are taking that questions only. So I am going to show you the some slides also on that. So, yeah. The friends who are connected with me or always know that my everything starts with my Mata Rani blessings. So, Ya Devi Sarva Bhuteshu Chikitsa Rupena Sansita Namastasya 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 Namo Namah. So now coming to the first query, I'm opening the questions what the Diksha had sent it to me uh, on the WhatsApp. So friends, we know that why this HPV vaccination is necessary. There are a lot of queries have come to us by the doctors also that is it like that this vaccine is important to give? Do you think that this just a second, I'm opening the questions. Yeah. Hmm. So, is it like that this vaccine is the need of the hour? So yes, friends. So because what the statics have suggested these days, um, as we all know, yes, India is having a huge burden of HPV related cancers. So we have seen the lot of the CA breast cancer and the cervical cancers. So again, there a query comes in the mind: is that this vaccine is going to prevent us only by the cervical cancer? So no, friends, we can say this vaccine is going to prevent us from the cervical cancer, vaginal cancer, anal cancer, and vulval cancer also along with the wards. So once we are counseling to the patient or telling, so we have to explain them that not only from the cervix, but along with the that the vagina, anus, and vulval cancers can also be prevented. So she has sent me the another question. Yes, I will take one by one. Dosage schedule immunocompromised. Yes. Yeah. So I'm skipping this. Taking. So the question comes that is it only this vaccine is the prevention for this HPV? So friends, yes, we have to take the advantage. As we know, the breast cancer is also on the rise. So, but for the breast cancer, once we are diagnosing when there is a breast lump, then only the operations can be done. Nothing like that because this is the cervical cancer is the cancer for which for the prevention the vaccine is available. So yes, so we can, if we do the prevention, we all know the prevention is better than cure. So screening for cervical cancer, as per the CDC guidelines, studies have shown the routine screening for women in the age group of 21 to 65 years can help to prevent the cervical cancer. So the question comes, lot of young doctors are asking me in inbox also, ma'am, what is the routine age group? So this is the 21 to 65 years of age group. So again, the question comes: is it like that HPV vaccine is well tolerated by all, or there are some side effects has been reported? So usually the studies have shown the vaccine has been well tolerated. In further more slides, I will show the some more slides related to the some side effects which has been reported. Now coming to the patients are coming to us and telling, Madam, we are in a mutual monogamous relationship, and I'm always doing the intercourse with the protection. So, then why it is needed? So, yes, is it like that? Still, this vaccine is helpful in protecting some of the HPV virus? Yes, of course. Why? Now I'm showing you in the further slides. As we know, usually the what the studies have shown that the cervical cancer has been caused by more than 200 types of the HPV virus. Until now, friends, we are having the vaccine for the prevention from only 9 type of the HPV virus. So that's why it is very important to take the vaccine. Earlier, the vaccine which was available that is covering only the two strains, the 16 and 18. Later on, the quadrivalent has come, which is covering the 16, 18, 31, and 33. And now the nanovalent vaccine has come. So the bivalent, as I told you, the 16 and 18, which is responsible for more than 70% of the cervical cancer. Then this quadrivalent, which is covering along with 16 and 18, the 6 and 11, which is causing the genital warts. Now, the nanovalent, because with this vaccine, which the agents which are causing the cervical cancer, so it If you're taking this kind of vaccine, this is giving you protection from more than 90% of the cervical cancers. So, besides 6, 11, 16, 18, this vaccine is giving us the protection from 31, 33, 45, 52, and 58. So once we are counseling the patient, yes, we have to explain them properly. Yes, the 31, 33, 45, 52, and 58. So again, the studies have come that who should get vaccinated against HPV? Uh, Only the males or both? Mm. So the answer comes, there are a lot of guidelines has been published. So yes, the vaccine can be given to all the females starting from the 9 years of age should be vaccinated. Then the quadrivalent vaccine, which is covering the four strains, the studies have come for 9 to till 45 years in females. Then for this nanovalent vaccine, the earlier the license was there is from 9 to 26 years in females and 9 to 15 years in males. Friends, here again I remind you because this quadrivalent vaccine is available in India from the two companies, from the Serum and from this uh, MSD also. So usually the serum vaccine which is available from the serum, because that vaccine is from the Pune only and I am practicing in Pune. That is the owner is staying in the same so where I am staying, because this serum if this vaccine has given the studies and up to the efficacy of this vaccine from the age group of from 9 to 26 years. For this, especially for the Cervarix. And for this Gardasil, the studies has come up to the 9 to 45 years. Then again, the studies have come, then a very important question come that, madam, can we give this vaccine during pregnancy? So no, answer is no. That this vaccine cannot be given during the pregnancy. Is if the lady is approaching to us for the infertility treatment while counseling, we tell them that this vaccine is important. They have to take. If she has taken earlier one vaccine and then she has become pregnant, then after delivery we have to cover the two doses. No need for giving all the three doses. So earlier, if she has taken the two doses, the remaining one dose she can take later on. Mm. So as I just told, HPV vaccines are not recommended for the use in the pregnant woman. There are no studies has come, specific studies for the safety of this vaccine in the pregnant woman. These references I have taken from the WHO guidelines in 2022, which are again reassessed on 15th March 2023. So, so it is not recommended during pregnancy. Now coming to the what should be done if the patient has taken the vaccine, the first dose, and then she has become pregnant? So is it like that she has to go for the termination of the pregnancy or no? No, friends, there is no need for the termination of pregnancy if she has taken inadvertently during the pregnancy. The rest two doses she can cover post delivery. Usually, post delivery, we are giving these doses post 6 weeks. Means once we are calling the lady for the follow up, at that time, post 6 weeks of the delivery, we can give this. So, again, she has asked me the question that if this vaccine, let me open my WhatsApp. Yeah. So, can immunocompromised patients can receive the vaccine? So what is the answer? Means immunocompromised or who are suffering from the HIV. So friends, the studies have shown the immunologic response to HPV vaccine may be diminished in immunocompromised individuals. We all know. So better there is no harm in giving, but once we give the vaccine, we have to explain that patients, yes, these patients can take the vaccine, but the immunologic response is little bit lesser in these patients. Now coming to the another question that uh, what about the efficacy in the breastfeeding females? So yes, this vaccine can be safely given in the ladies who are breastfeeding their babies. Studies have shown that this vaccine, the clinical trials have shown that it do not affect the safety of the breastfeeding mothers to their infants. So these all are the recent studies which has been published in 2023 only. So then studies, another query comes that, yeah, hmm, another query comes that thus the people who are already sexually active, they will get some benefit from the HPV vaccination, whether yes, no, or it is not sure yet. So friends, studies have shown, this is a study has been done in 2023. Yes, the studies have shown this vaccination may help or benefit the sexually active individuals as well. So, studies have shown that who have not taken earlier the vaccine, definitely there is some little lesser incidence in the HPV related diseases and cancer. So, the HPV vaccine may help to protect the individuals infected with HPV against high risk type HPV that they may have not yet acquired. The vaccination does not cure the current HPV infections. So now coming to the guidelines, this question has been asked to me by so many doctors. So many times I've replied this answer in the Facebook Messenger also. So studies have shown, friends, that this vaccine, which has been available, so studies have shown that for 9 to 14 years for this quadrivalent vaccine, 9 to 14 years in the females, the two doses schedule 0 and 6 months, while 15 to 45, 0 to 6 has been recommended. So while for this Gardasil 9, the studies have come. Earlier it was 9 to 26, but now we are giving up to 9 to 45 also, 0 to 6. And for the males, 9 to 15 years also we are giving 0 to 6. So and the males who are covering to us, if the females are covering coming to us for this Gardasil 4, usually we are giving 0 and 6. These are the from the guidelines. अभी बहुत सारे डॉक्टर्स मुझे बोलते हैं कि उन्होंने कहीं पर लेक्चर पे सुना था कि नहीं, सिंगल डोज भी देने से सर्वाइकल कैंसर का इरेडिकेशन होता है. नहीं फ्रेंड्स, ये दीज आर द लेटेस्ट गाइडलाइंस व्हाट आई एम showing you the PPT. While for the females, the 15 to 45, the age group is 0 to 6. जबकि for Gardasil 9 is 9 to 26, but we are giving practically from 9 to 45 is 0 to 6, and for the males also we are giving the 0 to 6 schedule. So, why this vaccine is recommended in such a young age? So, friends, as we know, this HPV vaccination prior to 15 years of age results in 2 times higher HPV antibody titers when compared with vaccinating at 15 years of age or older. Early vaccination helps to provide the higher reduction in lifetime risk of cervical cancer. So, now what are the contraindications for this vaccine? So, friends, we can see the people who have recommended or who have having a history, not recommended, sorry, having a history of life-threatening allergic reaction to any ingredient of HPV vaccine, to a previous dose of HPV vaccine, the pregnant woman, people with moderate or severe illness should wait until they are better. So, what are the guidelines have suggested if one dose has been missed? So, guidelines have suggested the HPV vaccine series should not be restarted if there is any interruption in the vaccine schedule or delay between the doses. Only the remaining doses should be administered when the recipient is willing to complete the schedule. Hmm. Then studies have come, and lot of the queries from the some doctors and some patients also. Is it like that we can interchange the HPV vaccine, whether first she has taken the one and now we can give her the another schedule? So no, friends. There is a limited evidence regarding the safety and efficacy of HPV vaccines when used interchangeably with one another. The available vaccines may contain the different components, so every effort should be made to use the same vaccine for every dose. So another query comes, can we give this vaccine along with the other vaccines? So yes, with some vaccines, HPV vaccine can be administered concomitantly at a separate injection site, following with inactivated or live vaccine, meningococcal vaccine, tetanus toxoid, reduced diphtheria toxoid, diphtheria, tetanus, acellular pertussis, or poliomyelitis vaccine. We have to remember, yes, these can be given together, but on a different injection site. So now coming to the question that what are the side effects has been reported by this vaccine. So friends, as we know, this vaccine is usually well tolerated. No such serious side effects has been reported. The some common side effects are redness, pain, swelling. Hmm, uh, I have to answer this call. Huh? Sorry, not able to mute myself. Hmm. Hmm. Sorry. Diksha, sorry. Huh. Hmm. So, yeah,
No problem, doctor.
yeah,
Please carry
yeah,
on.
yeah. So, is it like that? Is the HPV vaccine is well tolerated? So, friends, yes, the studies have shown this vaccine is usually well tolerated. Some of the most common side effects with the vaccine are usually as the redness, pain, swelling, systemic adverse effects such as headache, fever has been reported in some cases. Now, there are some myths related to this HPV vaccine. Let me see what more questions Diksha has sent me. Yes. Hmm. I will show that. Yeah. Hmm. Uh, that the why this vaccine is needed for the males also. Yes, the males experience the higher rates of the recurrent genital warts. HPV transmission from females to males is higher than more males to females. Hmm. So, friends, here you can see. Um, That's why the vaccine has been recommended for both males and females, as the risk of transfer in the from the females to males is more. Hmm. Hmm. So these are the some studies which have shown in the favor of that. Hmm. So there is no such studies has come that this vaccine is causing the infertility, as lot of patients having lot of patients having in their mind that this vaccine is causes the infertility. Hmm. So this we have already covered. Huh? Now one important question which usually the patient asks us and doctor also asks us, is it like that before doing this vaccination is the doing of the pap smear testing is compulsory? So no friends, there is no need for doing the pap smear testing before this vaccination. This vaccine can be given without pap smear testing. But still, if you have taken the HPV vaccine, whatever the guidelines suggest you to take about this HPV vaccine, means about this that pap smear testing about after 2 years if the test is normal, or if for the HPV testing every after 5 years if the test is normal, that you have to follow. So Then the people ask me that once we have taken the HPV vaccine, there is no fear of getting this STD in future. So friends, nothing like that, because this vaccine is giving you protection from the 9 type of viruses. So we have to be very, very careful for the other infections also. So prevention is always better than cure. So there is no routine pap smear testing before the vaccination. So this I've already taken. Yeah, yes. So Shweta, if there are any more questions, you can ask me. I had taken almost all the questions. Yes, one more question you had sent me. Let's
So there
see.
is,
Huh.
are there any updates or changes in the recent guidelines?
These I shown you, that I shown you. That are the recent guidelines only.
Okay.
And huh.
And the
And
last
how
question
can
here is, how
huh,
can we improve HPV vaccine coverage in
huh,
rural or undeserved populations?
populations? For that, yes, lot of education, and we have to aware all the public, yes, by the different medias, like your channel is also doing the one of the great thing to create the awareness. And but with the only this like that, for this Gardasil line, the cost is a major factor. So yes, if the prices will become little slashed down, so definitely there will be a more acceptance. अभी तो 2-3 साल में काफी acceptance बढ़ा है लोगों का, लेकिन एक प्राइस एक बहुत बड़ा रिस्क फैक्टर है still. This vaccine, they have to take from the come and take from the private doctors. It is not freely available. अभी बहुत सारे NGOs are saying that they are giving this kind of vaccine to some smaller class. So, but this vaccine has to become in the guidelines, डायरेक्ट गाइडलाइंस में आना चाहिए. जैसे पोलियो का वैक्सीन मैंडेटरी हुआ था, उसी तरह से सर्वाइकल कैंसर का वैक्सीन भी मैंडेटरी होना चाहिए. So we will see still what
Great,
happens.
doctor.
But lot and lot of awareness is needed. Hmm.
So the key takeaway for today's event is that it should be promoted, and it should
Yeah.
be, the price should be reduced so that
Yes.
maximum people can benefit from this vaccination.
Yes. Correct. Correct. Correct.
Yeah, great. So now, Doctor, it's time that we move towards the closure. So we extend our sincere gratitude to you, Dr. Ritu, for sharing your valuable insights on this important topic today on HPV vaccination and thoughtfully addressing all the questions in detail. So the session, as always, was truly outstanding, rich in knowledge, and full of engaging discussions. We look forward for hosting you in much more enlightening webinars in future as well. So thank you so much, Doctor, for joining in today with us. Thank you.
Thank you. Thank you, my dear. Bye bye.
Namaste. Bye-bye.